Hello, I'm Reverend Daryl Moak. I'm one of the co-chairs of the Places of Worship Advisory Board of the DC Department of Health. And we are really excited and grateful that you have taken the time to look at this video to see what you can do to help advance whole person health in your faith community. And so we are very excited about this work. We've been working on this work for many, many years, and what you're going to find in the toolkit are items that you can utilize to share information that's about health and wellness and whole person growth and development for your faith community.
I'm Elder George Kerr from Westminster Presbyterian Church down in Southwest Washington, D.C. Well, in Southwest Washington, D.C., we are faced with many health disparities, from HIV to violence to just across the board that we're trying to address.
My name is Pat Fisher. I am with MedStar Family Choice in Maryland, and I'm also a Ward 5 resident in the District of Columbia. So health disparities in the community particularly are around mental health, around sicknesses, illnesses, and diseases that derive from diets and foods and things like that in general. So the health disparities on a wide range across DC, Maryland, and Virginia are huge just because they have a lot of contributing factors.
I'm Donna Gales. I am the care representative from Capital Caring Hospice Services for Washington, D.C. One of the greatest disparities, I believe, is the lack of information and understanding regarding health overall. Being in the business of end-of-life care, we speak to people in all capacities of life, all ages, and what I've found is that information varies with people's experiences, and unfortunately, information that changes situations hasn't always been available to everyone. So I think the biggest disparity is lack of information.
My name is Raymond Bullock. I'm a deacon at Rising Sun Baptist Church, more senior church, so we have recognized that some of our members are dealing with Alzheimer's. We have some of our members that are in need of kidneys at this point. We find that some of our senior members who are greater concerned are in need of hearing devices, of something to help them. And mostly we detect those things by just sitting and talking through conversations and just having with us. They share their personal health needs with us, and from that point we can see what type of resources we can reach out to assist them.
My name is Henna Zaberi, and I'm the director of Rashidun DC. So we serve one of the most impacted communities in Washington, D.C., economically impacted. We are in Benning Terrace, Woodland Hills, Potomac Gardens. These are housing projects in Washington, D.C. in Ward 7 and 8 that do not have access a lot of times to healthy food. There's no grocery store. Sometimes for 45 minutes they have to walk 45 minutes to get to a grocery store. So just access to food and healthy food is a big issue for our community members.
Good afternoon. My name is Minister Chi Mawuso, and I'm with the Washington Family Church in Washington, D.C. Well, basically, I'm a part of a women's group. I also have the health ministry, and the ladies are talking about breast cancer. So that's the most thing that's impacting our community.
I think some of the things, our ministry has been focused very much on health and HIV-related issues for a very, very long time. And I'm actually the co-founder of our nonprofit, Interlight Incorporated, which also does a lot of work around whole person health. And so what we're finding, it isn't a single disparity, but we're just finding the ability of people in various communities, especially poorer communities, even within the District of Columbia, being able to access the resources to both understand the information and to interpret that into a pattern of behavior that will help them be able to live healthier. So that's really where the challenge comes in, is that the dissemination of good educational information so that people can actually use the information.
I'm Reverend Tony Lee. I'm the pastor of the Community of Hope AME Church in Hillcrest Heights, Maryland. So when I think about the health disparities that impact the folks in my community, you can look at a range of them, whether it's around HIV and AIDS, whether it's around cancer, whether it's around issues around domestic violence, whether it's issues of diabetes. I mean, you can just run the gamut. If you look at where my community is and where my church is, that we are in what I call the red zone, that demographically we hit all of the reds, that we hit most of the disparities in most of the areas. And that's why the church is there, because the Lord said that, and I believe, and our church believes, that church is the greatest where need is the most. And so we're in the places where the disparities are, because that's the place where the church can make the difference.
Peace, shalom, assalamu alaikum. My name is Imam Bilal Prather. I'm a founding member of 2 organizations that work with health equity and disparity, of getting rid of disparity of health outcomes. I guess you could say I'm one of the brothers from the hood, from down in the inner city neighborhoods. And so obviously we're living at a time of rapidly growing inequalities with regard to health equity and outcomes with health, especially in the inner city. We have epidemic rates especially with women, of new HIV infections. We have the epidemic of, only in the African American communities in the inner cities do we find dialysis clinics in every neighborhood, just like they were a franchise. If you see McDonald's, you're going to see a dialysis clinic. And so we work to study the effect and of this inequity in health services and just in health circumstances.
Greetings. My name is Reverend Samuel Nixon Jr. I serve as a council member with the Northern Virginia Clergy for Prevention of HIV/AIDS, and also associate minister with the Alfred Street Baptist Church as part of that organization. We have, of the ones that we see regularly, we have the health disparities or cancer. We also have the proliferation of cancer, both in terms of breast cancer with women and our prostate cancer with men, and then other cases of lung cancer in those areas there. We also see a good deal of what's going on in terms of the different HIV-related activities in our community too, HIV itself, and then some of the STDs that are associated with it. And we have some of the disparities in terms of things that come up for, I should say, obesity, the things that deal with dietary irregularities and those kinds of areas.
I'm Reverend Dana Mitchell Toliver, also known as Salia Malia Kakama, the gentle, kind, caring queen who is an angel of love. I am associate pastor at the Imani Temple National Cathedral, and I am the director of health and wellness for the Imani Nation. I am also privileged to be one of the co-chairs of the Places of Worship Advisory Board. My heart is heavy when I think about what my people are experiencing. Cancer, breast cancer, cervical cancer, a heart disease. I have so many people who are going through with those issues, swollen legs and barely can get around. Some mothers of the church, they're just as cute as they can be with the cutest outfits and sick as they can be and eating themselves into a state of a death state. I hate to say it.
Peace and love. My name is Darius A Stanton. I'm the CEO and president, CEO and founder of the Stanton Group, Incorporated. Also the host of the Peace in the Morning show with Darius A Stanton. My faith community is a spiritual one. It's not connected to a particular denomination or religion, but just connected to us as a people, being connected to God and our universe. And one of the things that is a health disparity in the communities that I work with is mental health. which impacts how we think, how we move, how we treat ourselves, and in particular, our frame of reference, because we believe that people act based on their frames of reference. And what shapes your mental health are the things that impacted you, whether it was traumatizing, whether it was physical abuse, sexual abuse, you were connected to some type of secondary domestic abuse. Those things help to shape who you are.
My name is Carmi Washington Flood. I am the Chief of the Office of Faith-Based and Community Partnerships with the Prevention and Health Promotion Administration out of the Maryland Department of Health. Working within the State Health Department, the health disparities that we actually see across the entire state are many and diverse. We, of course, see a disproportionate number of health disparities within community of colors. So things like diabetes, hypertension, HIV, hepatitis, substance abuse, mental health, or I should say mental illness, homelessness, really all types of diseases, whether or not it's related to obesity, just across the range, you see communities of color are disproportionately impacted, that there is a lack of access and availability to resources and to care, as well as to persons understanding that they do have a right to access resources and care.
My name is Dr. Achille Akolatse. I'm from the Family Federation for World Peace and Unification, also known as Washington, D.C. Family Church. I'm the pastor of the church. Well, my community is really focusing on family values. So we have issues of trauma, mental instability in the community, but the tools that we use to deal with this kind of issue is really education. Education in terms of marriage education, marriage enrichment, because we believe that when husband and wife are united together, when they are one with God, then they can bequeath this tradition to their children, and we have stability in the family. The stability first starts with the individual. So we train, we give education on how you can be stable spiritually, intellectually, emotionally yourself first, husband and wife. And when they are stable, then when they come together in marriage and they are stable together as husband and wife, and they translate that to their children, we have a stable family. When you have a stable family, you have a stable community, you have a stable nation and a stable world.
Okay, my name is Gertie Williams, and I am with the Balm in Gilead. Diabetes, cholesterol, HIV, AIDS, Alzheimer's, various cancers, breast cancer, prostate cancer, mental illness. They are all health disparities that I see in my community.
Well, addressing trauma is not just addressing when someone has an issue. We recognize that trauma can also be an accident. Trauma can also be mental health. A lot of situations don't include mental health in regards to trauma. Trauma can honestly be from a health disparity also. So I think addressing trauma as a broad and understanding what connects the dots to trauma in people and children and seniors and communities is some of the great ways that you can overcome or actually give someone a resource connection to deal with that.
Well, trauma as defined can impact people in such different ways. But one of the things that I believe is so healing as it relates to resolving trauma is meeting people where they are. Because whatever has impacted one person isn't the first time that it's ever happened, and it won't be the last time. So I believe sharing experiences, being transparent, and being able to connect through empathy, through understanding, allows people to be strengthened. And that's what you need when you are responding to trauma, the ability to move on and do that effectively.
to address trauma particularly, I think one of the things that we're doing is raising awareness, right, and making it less stigmatizing to access and utilize mental health services. That medication, if it's needed, for whatever chemical imbalance may be going on inside of a person or whatever's happening on that's dysregulating their moods, their emotions, or their behavior, or their cognitive functioning, whatever those things are, we want to be able to address them in a way that's healthy and holistic and recognizes both the power of faith and the power of spirit, in addition to the power that we can have as human, from human to human, sharing our experiences and working through the nuances of those.
Addressing trauma, our church body, local church, as well as the clergy council, we have different mechanisms in each congregation, of course, and in my own local congregation, we address trauma through our ministries. And our ministries have both people who are practitioners around certain areas. So if it's someone, for example, with our recovery ministry, someone that's familiar with appropriate ways to address the trauma, dealing with recovery from substance abuse, whether it's alcoholism or drugs or whatever it might be, we have programs that they do on a regular basis. It might be weekly or monthly that they address that. And we also have our ministry that deals with grief share, so traumatic situations that come up in family situations, loss of loved one or loss of job or sudden death in the family. So the grief ministry is called Grief Share, with the implication that that is shared by members of the body of Christ, working with those individuals or those families in the case of doing that.
Clergy in church are experienced and equipped to deal with trauma, and what they can't deal with, we utilize the assistance of those who are in our congregation who have been professionally trained as clinical social workers and psychologists. And then after that resource, we utilize the resources in our community. Washington metropolitan area, even though we are physically based in Suitland, Maryland, the Imani Temple, people travel within the DMV to get services. So we find the best fit for them based on where they are.
There's a gospel song that says, "We fall down, but we get up." Resiliency basically is that once you've been down, the ability to bounce back, the ability to get back up.
We want resilience to look like opportunity. We want resilience to look like privilege. We want resilience to look like options. And when we address the faith community and when we work with faith leaders, what we want resilience to look like is people standing on those things that they say they believe. Healing for us encompasses intentional collaborations across the state, within all of the jurisdictions. Healing for us means that we believe that every single citizen should be able to access care. Healing for us means that every single citizen should have unfettered access to care, that there should not be barriers or undue challenges, there should not be a privileged class or an underclass, that there should not be a caste system, that the quality of care should be at definitive standards, no matter how I am paying, because we believe that public health says everybody has a privilege to access the best care that is available.
Healing looks like, first of all, the faith community coming together with different programs and projects and ministries that try to address the health disparities that are around, support groups, also health and wellness workshops and conferences, Healthy Churches 2020 by the Balm in Gilead, where we bring together all the health resources as well as lay leaders and health professionals to try to discuss and come up with solutions.
What I can say for MedStar Family Choice in general, we connect our members to their providers, to the correct providers. We are making sure that we are visible for them in general. In regards to trauma once again can be so many things, and that's what we recognize as being a part of the community, that it might be a mental health connection or healthcare professional. So we're always available to connect our members and the community, our member community, to the proper places that they need to be.
That we've been doing is having community conversations and just coming in and having conversations to address the issue. For example, we've had one on gun violence. We had one on election trauma. And so just trying to prepare the community and giving the community a chance to have a conversation around it, to get it off of their chest and to understand that they're not addressing this by themselves.
I am Reverend Skip Jordan, and I am a chaplain and a volunteer coordinator with Capital Caring Hospice Services. As a hospice organization, we minister to people in all different types of situations in terms of their health issues. People come into hospice with a diagnosis of a life-limiting illness. We work with the patient and with the families to walk that journey together as a team with our doctor, our nurses, our chaplains, social worker, volunteers, and our CNAs work together to make the best life that can possibly be for the patient and for the families, to support them in whatever way is necessary. We work together as a team to achieve those goals, to give the patient the best possible life that they can have.
My name is Barbara Chin, and I'm with AIDS Healthcare Foundation. I'm Senior Program Manager for Testing, Prevention, and Community Outreach. My focus, though I am a faithful person, and I am working with POAB, Places of Worship Community Advisory Board, my personal interest is around HIV, and that is what my organization's mission is. We are trying to eradicate HIV, not only within our community, but throughout the world. We are the largest AIDS service provider for nonprofits in the world. We're in 36 different countries, and we have 3 locations actually, here in the metropolitan area, 2 in Washington, D.C., 1 in Temple Hills, Maryland, and soon 1 to be in Baltimore.
Unfortunately, in my apostolic church, which will remain nameless, we don't have anything that, we don't have a specific health ministry. We basically, and this, I have to say it this way, the apostolic church is more focused on carrying the gospel of Jesus Christ forward. And in my church community, I don't think that we have enough focus on the health ministry that should be.
That our church, we do HIV testing quarterly. And so quarterly during church service, not after church service, but during church service, we do testing quarterly. I will get tested in the pulpit, our ministers get tested, and then members can actually leave the service and get tested and then be able to still get back in time for the sermon, because we wanted to make sure that we were able to help destigmatize issues around HIV and AIDS, and we are able to say that taking care of your body, knowing your status, being able to take care of your health is a part of your theological practice, is that when we're able to do that, because of our partnerships, those who test positively are able to get plugged into wraparound services right there. And so then they're able to get plugged into wraparound services right there, so that they're able to get the kind of health care they need to make sure they're able to not see HIV infection as a death sentence, but more so as being able to step forward to be all God has called them to be.
We promote and do the outreach, the upreach, the inreach in our community to make access to treatment more available. We strongly promote recovery groups, spiritually based recovery groups from all of the ailments that plague our inner city communities.
We deal with a great deal of violence in our communities, but we also recognize, based on research, that violence starts at home, and the violence that we see in our communities is indicative of the domestic abuse, child abuse, and neglect that children have experienced in the home. And so what we've worked to do is create resources for children and families that have been traumatized by violence.
Where Washington, D.C. is a part of Brothers Huddle, and Brothers Huddle is a program where once a shooting takes place in one of our communities, then our Imam, our religious leader, takes about 25 men, and they go out into that neighborhood where the shooting has taken place. And they go out and talk to the young people on the streets. And this is sometimes at 11, 12 o'clock at night, when even police will not go there because they find it too dangerous to be out there. And because the Imam has grown up in these neighborhoods, has friends, this is his home. So he feels very passionately about this program, and we have a fish fry on Thursday nights where the brothers do also go out. And then once the boys come in and the young men come in, and they take them in a circle and they sit down and talk to them. So it relieves that pressure that could be building up, that could lead to more violence.
The health departments, Maryland Health Department, Virginia Health Department, and I represent the Department of Health. My name is Regina Jefferson, the coordinator of interfaith programs for the District of Columbia. We have decided that we no longer want to individually work with the faith communities with the initiatives that we are over, but we decided to come together, bring our resources together, bring our initiatives together, bring the faith leaders together today, and we're going to create a toolkit. That's what this is all about. Why am I excited? Because we have come together for one purpose: to provide resources for the faith community.